Hello and good afternoon, everyone. Welcome to today's Career Discovery live stream presentation on healthcare careers, assistance, and tech careers. My name is Amanda Wydula. I'm the University and Student Development Coordinator at the Bank of North Dakota, and I will be facilitating today's webinar. During today's session, attendees will learn about education, duties, pay, and career outlook for careers as an assistant or tech in the healthcare industry. Just some housekeeping items today. In the menu of the webinar, there is a Q&A function that we encourage all attendees to use for questions or comments that you have about today's webinar. We will answer them throughout the webinar as well as at the end, but please put them in the Q&A box whenever you have them. We have two panelists today. Tracy Seibel is the medical lab tech clinical coordinator and assistant professor at Bismarck State College. She also works part-time at Sanford Medical Center in the Transfusion Services Department. Tracy achieved her bachelor's degree from the University of Jamestown and her master's from UND. Mike Little is the executive director at the North Dakota Dental Foundation. Mike is an experienced and enthusiastic entrepreneur who gets excited leading ideation to implementation of innovative products and programs to improve the health and well-being of others. Currently, Mike runs two statewide nonprofits, the North Dakota Dental Association and the Optometric Foundation of North Dakota, bringing sight and smiles to all North Dakotans. So thank you both for being here. So attendees, we are going, before we get started into the content, I'm going to launch a poll. What motivated you to register for the live streams today? So all you'll do is go ahead and click one of the options. They are, I want to learn more about careers in healthcare. I'm watching as part of a class, or other. All right, and for those of you who put other, if you want to pop the reason you're into the chat box, there's also a chat box in addition to a questions box. So if you want to put your information in there too, that would be wonderful. All right, we'll just give you another couple seconds here and I will close this poll. All right, so most of our folks who are watching today want to learn more about careers in healthcare. All right, so our first topic today is, what are some of the different types of assistant or tech careers available in each of your fields of expertise? So Mike, we'll have you go first today, or in this question.
Yeah, sounds great. Okay, hi everybody, great to be here today, great to be with you, thanks for your time. So there are a lot of really good opportunities in dentistry. When you think about dental careers and what's available, in a typical dental practice, you would have the dentist who typically owns the practice or is a managing partner within the practice, and they do all of the procedures. You have a hygienist. So the dental hygienist is someone who cleans teeth. And that's what they do. And so if you enjoy cleaning teeth or being detail oriented and doing a very specific task over and over again, if you see 8 patients throughout the day, you're going to clean 8 sets of teeth. And so that's the hygienist. And then there's dental assistants. And the assistants are the ones in the practice who they're really vital to a dental practice. And they work one-on-one with the dentist. And so an assistant is somebody who helps with basically everything else in the practice. They help with, as patients come in, they'll work with those patients to help with scheduling. They'll help with if they have to take x-rays of the teeth. They help with tools during procedures with the dentist. And there's a lot of expanded functions as well that dental assistants are able to do. So those are kind of the 3 primary roles that we typically talk about within a dental practice.
Tracy.
Well, like Mike, welcome. I am so excited to talk to all of you today about laboratory medicine. Just like Mike, just like in the dental world, laboratory world, there are a lot of different steps of who does what. And we have the bottom level, starting at the bottom, we have lab tech assistants, where we can have, they're processing samples, and we can have phlebotomists who are drawing the blood from a patient. And then we go into patients, the individuals in the laboratory who are actually performing the tests. Most of the time when we look at a lab, we associate phlebotomy with part of going to the lab, but that is just a one small portion of what we do. There are actually, I call us the Wizards of Oz behind the curtain. We are back there, we are doing the tests, and then we actually even have physicians, pathologists associated within the laboratory who are there to help guide us and help us troubleshoot and maybe work with us intimately as a guide between us and the provider to help diagnose that patient, because ultimately it takes a team to ensure that the patient is being diagnosed correctly.
Wonderful. So you kind of mentioned the different tasks that are available in each of your of your areas, but are there some other things that the assistants and then the techs do as well?
Sure. Would you like me to go first since that's the order
Yeah.
we were using? Okay, sounds good.
Yep. Let's
We'll
do
do.
that.
Yeah, so the question was just, are there other types of roles? Yeah, so typically for, I'll talk about dental assistants specifically. They are able to help with infection control and get additional certification to be able to focus on infection control. They can also, there's different exams. The national organization is called DANB, D-A-N-B, that basically has exams that chairside trained assistants can do to get additional credentialing. And they also are able to help with radiographs, so taking x-rays. So when we think about that does require training. So like when you think about let's see. So when you think about like the types of teeth, oh, my camera just moved on me. I'll top it over to Tracy. Tracy.
Mike, I was in the middle of refilling my coffee cup. How dare you? So yeah, it's hard to talk about specific duties in the lab without mentioning what they do a little bit. The lab tech assistants, they are the ones who are taking the, well, let's start with the phlebotomists. The phlebotomists are the ones drawing the blood, right? They're calling the patient, they're identifying that patient, ensuring that they're supposed to draw John and they're drawing John and not Jane. And so patient identification is a huge part of their job. Once again, a lot of, like Mike said, healthcare in general is a lot of detail oriented. You can't just fly by the seat of your pants. You need to like that routine. And those of us who are kind of like a little bit of OCD do well. But the phlebotomists are there, they're drawing the samples. Sometimes they're putting the patient in the bathroom for them to collect a urine sample and instructing them on how to appropriately collect a urine sample, because there are good ways and bad ways to collect that sample. And then the lab tech assistants are there more so they take the sample, and maybe when we draw blood out of somebody, it's not in the right form for it to be tested. It is amazing. I don't have a sample here. I would love to show you, but when we take a tube of blood, sometimes we spin that tube in what we call a centrifuge. It goes around like at 3,500 RPMs. And what it does is it separates the blood into red blood cells on the bottom because they're the heaviest, and then plasma or serum on top of the red blood cells. And different tests that we do might require the serum, and some tests might require the red blood cells. So the lab tech assistant is there ensuring that that specimen is processed appropriately so that the next step, the testing, is easier and it flows nicer because that prep work has essentially been done. Lab tech assistants, and actually all of us who work in the lab, are always fielding phone calls, phone calls from patients. Do I need to be fasting for a particular test? Phone calls from providers, nurses. Hey, I just sent Jane down there for this test. Can we add on this test because the results are kind of suggesting something else is going on with our patient? And so we are there guiding, we're answering the questions, we're processing the samples. And then the people performing the test, we are there. It would be nice that everything, and you guys know anything we work with instrumentation wise can always break. Patient sample is not always optimal, and we may need to adjust it. We may need to perform dilutions. If somebody has a really high glucose level, sometimes our analyzers can't read that high, so we need to dilute that sample and so that we can get it down to a more detectable level. Sometimes, and that's called a critical value, so then I need to get on the phone with the nurse and then tell the nurse, the provider, that, hey, John, his glucose is really high, and if we don't fix this right away, it may be a life and death situation. It could be something, my instrumentation is not working correctly, so now I've gone more into mechanic mode, and I'm trying to fix some of the robotics that we work with on a daily basis. There are so many, depending upon what level you're at in the lab, your work duties definitely expand. Yeah, and then the cool thing is we have pathologists in the lab, and they take and look at the like tissues taken out of people, and they cut them up and help diagnose specific types of cancers too. So actually really fun.
Great, thank you, Tracy.
Yes.
I'm gonna hop in. I'm gonna hop back in since my camera is working now. Thanks for fielding my portion. Um, I just wanted to basically touch on a few other duties of dental assistants. When you think about what they're specifically responsible for, they assist with procedures, so such as tooth fillings, crowns, extractions. They take and pour dental impressions, so those are really molds of mouths. They help with preparing patients for surgery. They help operate equipment and monitors and things that are kind of associated with procedures. They are also responsible for talking with patients. A lot of healthcare is customer service oriented, especially if you're directly interacting with patients. That's really what differentiates a dental practice or a medical practice or phlebotomy center from any other one is that those people skills and talking with patients. They help perform administrative tasks. They can help with preparing examination areas, so space and tools and materials, and then cleaning up after procedures and helping with sterilizing equipment. And talking with individuals across the state who work as dental assistants, the reason they love it is because every day is different. It's a dynamic type of job. It's not the same type of thing. Even though you do some of the same things, the types of things that you're tasked with doing throughout the day vary quite a bit. And so that creates sort of an extra challenge for those who practice. So people skills are huge, the technical skills are huge, and administration, organization skills are really big for dental assistants.
Awesome. Thank you, Tracy. I just loved seeing you talk about the different tasks and how excited you got about that. That was great. Before we go to the next question, we're going to do another poll. So I'm going to launch this here. And this is a multi-answer one. So you can click as many of these that are relevant to you. So when considering a job or career, what kinds of traits are important to you when looking? So do you want to help people? Are you looking at the pay and benefits? Are you looking at personal fulfillment, location and mobility? So, whether they have those jobs in the area you want to live, or if you're able to move other places. And if you did say other, go ahead and pop what those other traits are into the chat box. All right, so we will give you a couple. It looks like we're waiting for a couple more folks to vote. If you haven't or participate in the poll if you haven't already, we'll give it just a few more seconds here. All right, I will go ahead and close the poll. So most people, the three most important things that they said were that they wanted to help people, the pay and benefits, and personal fulfillment. And I know when I used to work in college admissions, when we had students who wanted to go into healthcare, that was some of the number one things. They really wanted to help people. So that's kind of why I put that one in there. So let's see. what kind of career? We already talked about this one. Okay, so what kind of education or training do workers in these areas need, and are there growth opportunities? And Mike, if you could talk about the opportunity at Dickinson High School during this one, that would be wonderful.
Sounds great. Yeah, I'd love to. Okay, so if you want to become, let's see, out of the different careers, if you want to become a dental assistant, there's a few tracks that you can do to become a dental assistant. And that's actually one of the three key things of why we say this is such a great career choice, is that there's such a fast track to employment. And so if you want to be hired right now, you can. So you can go into a dental practice. There's pretty much a 100% job placement rate for dental assistants, because we do need them, and they're so in demand in North Dakota right now. And when you think about what that means, so you could become a chairside trained assistant. So you could start working in a dental practice as a chairside trained assistant. So they help chair. That means that you learn kind of on the job. And then after you earn 3,000 hours, you can, after you take this amount of time, you basically can take these exams to become certified. And becoming certified will allow you to do more within a practice, like doing x-rays and all these other things that kind of expand your ability to help that practice. And so to become a certified dental assistant through the Danby credentialing, that's kind of the ideal. So that's one option. You can become chairside trained. Secondly, you can go to a school. So there's M-State, there's Bemidji has a program, and then NDSCS in Wahpeton in North Dakota has a program. And they have two different options. They have a fast track option, and then they have the associate's degree option. The fast track option is like 10 months. So you go there, you learn what you need, you get some on-the-job training, and you're pretty much prepared to take your Danby exam. If you want to do the 2-year, you earn an associate's degree with it. So it's a little bit longer, costs a little bit more, and that's how you do that. So those are really the three primary tracks to becoming a dental assistant. We just are experimenting with a fourth track, which is starting at the high school level. So Dickinson High School is the first high school in the country to offer a dental assisting program that students are able to, as they go through it, are able to earn hours that apply towards taking either their qualified dental assisting exam, or could add up in combination to take their certified dental assisting. So it's huge. That's a really big deal. And so the first high school in the country. So we're seeing how that's working and looking to potentially expand that across North Dakota, which is pretty cool. But I think the key here is, if you're interested or if you want to get started and you're thinking about this as an option, reach out to us. I'd be happy to help connect you with someone, or your local dentist or somebody, talk to them about it, because this is something where we want to get you plugged into the dental community in North Dakota. And with that 100% job placement rate and fast track to employment, we think that it's definitely a win, and you have a great shot. And then I think I'll talk about hygiene too. So if you want to become a dental hygienist, that's a 2-year associate's program. And so the school like NDSCS has a program, the M-State and Bemidji as well. But that's 2 years to get your hygiene. And then if you want to become a dentist, I know that this is about tech and career, but if you want to become a dentist, that's 4 years of college, 4 years of dental school. Typically the costs for school and everything else, it just considerably goes up. But then to buy into a dental practice, it's a few $1,000,000 typically is the buy-in amount. So different varying degrees, but I would say assisting is by far the fastest to get into out of the dental careers.
Wonderful. Tracy.
Well, perfect. I, just like Mike, just like dental hygienist, phlebotomy is a profession that's in high demand, not just in the state of North Dakota, but throughout the whole entire country. We have phlebotomists can be on the job training too. You don't need to go to a school. You don't need to go through a certified program. You don't need to have any special training. You can apply. You can walk in the job on the first day and say, train me, and you get paid to be trained. So that's bad for me because then I don't have people taking my phlebotomy classes, but it is great for the industry and allowing us to supplement the need at a very quick rate. In order to do that, though, you do need a high school diploma. I know other areas within our healthcare sciences program at BSc, like an EMT, that can be done with at the age of 16. You don't necessarily, you can be in high school to be an EMT, but to be a phlebotomist, you need to be have that high school diploma, be 18 years of age. So all on the job training for phlebotomists. We do those lab techs assistants who are processing the sample. They can also be on the job training. And then, of course, there is tons of room for growth. I always recommend, and I know this is a question later on, but how do you get your foot in the door? What recommendations do I have? If you are interested in healthcare at all, work in a hospital, work in a dental office, even if it's something as simple as housekeeping. I have one of my students delivers trays to the floor. You know, we get our foot in the door, we work our way up the ladder, phlebotomy, lab tech assistant, and hey, this is really cool. I want to go to some place like Bismarck State College and get my associate's degree in medical lab technician so that I can actually do the tests. I've learned about drawing them, I've learned about that, but I want to know how to do the tests. I want to help in that aspect. And then I kind of compare our profession to a little bit like nursing. We don't like to compare ourselves to nurses, but nurses have that LPN level and an RN. We have an MLT and an MLS. So they're just 2-year degree versus a 4-year degree, and then doctorates and PhDs and all of that. But high demand area. One thing to add on to Mike's earlier comment is being a people person. Honestly, most of us in the lab kind of get here because we want to help people, but at the same time, we don't want that patient interaction. The lab, like I said, is more behind the scenes. Besides that phlebotomist, a lot of us are sitting in front of an instrument, sitting at a lab bench and doing the tests so that if patient contact scares you about healthcare, there are other options. If you're an introvert like I was, there are options for you to help people. The lab isn't full of introverts. There are a lot of us that are more outgoing. We have grown into an extrovert kind of world, but yeah, lots of opportunities for growth.
Wonderful. Well, that's great. So this next question, I asked it in the group on our Tuesday presentation, which was about those different aides. So, you know, the folks who deliver the trays and all of that kind of stuff, and they just laughed. So what is the average workday like for an assistant or a tech? And Mike, we can have you go first.
Sure, yeah, sounds great. You know, I think for a dental assistant specifically, it varies. So day to day, it's not necessarily the same, but like I said, for hygiene, dental hygienists, you clean teeth. So that's very much a very similar routine kind of role. You know, I think that typically the assistant will start, they'll get their station set up, so they get all of their space set up the way that they need it for the day. They go over their schedule so they see which patients are coming in. A nice thing about a dental practice is that you typically every 6 months, a lot of patients come in for their cleanings. And so you develop really good relationships, close relationships with your patients. You have a really good camaraderie and sense of team spirit with your colleagues, all of your coworkers. A lot of dental practices, you know, just like to have a lot of fun. Typically, a lot of practices have Fridays off. So usually you work Monday through Thursday, usually normal hours. So an 8 to 5 kind of day, 8 to 4. Typically, no weekends, no nights, no on call. So that's when we compare it to nursing or other careers. You know, a lot of those do have overnights or on call hours. And so if you're thinking about family, if you're thinking about kind of a normal work schedule, it's a great work environment. It's sort of an office setting. And so very kind of clean environment. And so part of the dental assistant's role is to help make sure everything works smoothly throughout the day. So they're basically planning ahead, looking at the schedule, seeing which patients are coming in, talking to those patients when they come in, assisting the dentist with their procedures and their work. And that's the day. And so and then a lot of times they get asked to do things that are different or abnormal depending on the patient and the patient's needs.
Those duties is assigned, right?
Yes, yeah.
And Tracy.
Well, I wish I could say that we were an 8 to 5 Monday through Thursday job, but we are, most of us are at a hospital-based laboratory. There are clinic-based laboratories, but those of us in the hospital world, hospitals are open 24/7. So we do have shifts of all different overnights, we have evenings, day shift, weekends are usually a requirement. But it also works well for, I know many families that I've worked with, the wife worked the morning and the husband worked the afternoon, and they didn't have to pay daycare. And having the ability to work those off shifts was fantastic in saving some money. Plus, you usually get paid more when you work those off shifts because nobody wants to work them. And hospital pay is a little bit better than clinic pay because, once again, clinic gets the cushy hours. So
Great. All right, so we're going to do our final poll. So I will go ahead and launch that. So which two-year healthcare career are you most interested in? And since we do have a lot of guidance counselors on the call today, career advisors, all of that, if you want to answer this on behalf of what, or in the vein from what you hear the most from your students, you can go ahead and pop that in. And again, if you do select the other radial button, you can go and put what that other is in the chat. All right, so we're just going to give it a few more seconds. So far, over 40% of our attendees have listed Surge Tech as the one that they're interested in, but dental assistant and medical lab tech have gotten some responses as well. So I will go ahead and close that poll. All right, thank you, everyone. All right, so the next question, what are the pay benefits and hours like? And Mike, you can go ahead.
Yeah, sounds great. So like I said earlier, typically it's Monday through Thursday, normal office hours. And I think when you think about pay in general, that's actually one of the major points we kind of share about dental assistants is that North Dakota in particular is one of the top 5 states in the nation for dental assisting pay. And so you can make a really decent living, specifically in North Dakota. That comes from the U.S. News and World Report. When we think about the growth opportunities, I didn't share this before, but typically on average, all careers are expected to grow about 7% in the next decade. Dental assistants are expected to grow 19% nationally. And so definitely a huge growth opportunities in the future. And I think that pay in particular, that's something where so on average, the pay is about $22.31 an hour. But I know that salaries tend to go up typically in high demand areas. And so, when you think about across the state, it's kind of, this position is in demand pretty much all over the state. And so I think individuals can kind of demand a higher salary, especially now with that being the case. But yeah, top 5 in North Dakota being the top 5 states for salary for dental assisting.
Awesome. And Tracy.
I really don't even want to answer that question after Mike. Lab pay is horrible. We are probably in the bottom 5% of states in throughout the United States. But in Bismarck, it's the lowest. I know, like, if I would go to Fargo or even Jamestown, which is more of a rural, or any of the small hospitals throughout the state, they're always going to pay more because they need to attract someone to their smaller community, because people want to live in Fargo and Bismarck. Fargo is higher because they're closer to the cities. They have a higher cost of living. Bismarck, I don't know why we're not that high. So it's not the best, but it makes you feel good when you're helping a patient.
And it sounds like you can basically just kind of pick the hours that you want because hospitals are open 24/7.
For sure.
Okay. Awesome. Okay, so our last question, I know we're running a little bit over, so I would just like to remind everyone that if you do have a question, you can go ahead and pop it into the question or the chat feature, and we will address it at this time. So Tracy, you already gave a little piece of advice about these careers, but so if you want to share another piece, that's great. Otherwise, Mike, it's all you.
Okay, sounds good. What piece of advice or guidance? I would say that if you're at all interested in this, do some shadowing. So connect with your dentist or a dentist that you know, or just cold call a dentist and say, hey, I'd like to shadow you. And they can arrange that. And I think spending some time in a dental clinic, seeing firsthand what the work is like, I think would be really value added. Dentists are, out of all my history, I've worked as a primary care manager at a hospital setting, and have worked with vision doctors and dentists and a lot of different groups. And I can say that our dental community in North Dakota is very friendly, warm, inviting, and pretty easy to get along with. And so I would say that it's a close-knit community statewide. So if you wanted to maybe shadow somebody in your local community, or if you knew of a community you wanted to move into, they could probably connect you. And also I'd ask, if you're interested, reach out. Our website's nddental.org. You can go there, and there's information about our Bright Futures in Dentistry program, which is to promote dental assistance. But we have information about dentists on there as well. Our contact info is included. So reach out to myself, and I'd be happy to connect you with a local dental practice for those shadowing opportunities. And I think that's a great way to do it. I think also I've had some friends who wanted to get into dental school and they didn't make it the first time, and then they went and did the I think they did like a Peace Corps mission and some other things, or the military, going into the military and then having them pay for your dental school. I know people who've done that, and it tends to be a cost-effective strategy. But I think that those experiences you can get that are outside of a classroom, that are extracurricular and give you real world experiences, are ne plus ultra. They're hard to beat. You can't beat those kind of real hands-on experiences. So I would highly recommend doing those types of things, making those connections with local dentists, and reaching out to us if you're interested. Thanks.
Awesome. Thanks, Mike. Tracy, anything else?
Just one other thing. I talk about phlebotomy from a hospital perspective, but there are various donor centers throughout town also that will train you, like any Vitalant or BioLife or any place where you donate blood. They are willing to do that same on-the-job training and get a glimpse at the life of what a phlebotomist would look like. So, and then for those of you who are career advisors, I'm glad Mike mentioned this. I know, like, when I went to school, med school was always on my list, right? And I know I went to school, college being a biology major. But when you learn, not all biology majors get into med school. And there are a ton of physicians in our community who have gone to get a lab degree and then made it into med school that way. So if you're ever advising students what to do with their life to get into med school, lab is a great stepping stone into any career in medicine.
Awesome. Well, that is great advice from both of you. So thank you so much. All right. So last call for questions, those of you who are listening. All right. But thank you, everyone, for joining us today. Our next Career Discovery webinars will be next week on Tuesday, March 16th at 2 p.m. And we will have a presentation by the TRIO program. And then on Thursday, March 18th, also at 2 p.m. on vocational rehabilitation services. Both of these presentations will highlight different services in North Dakota that help both high school students and college students be successful in college and career. So you can register for these and all Career Discovery webinars on the Career Discovery tab on our Career Discovery website, Career Compass website, but you can also view all of our previous presentations as well. So both the presentations we've had in the fall and already here this spring. All right, we are not seeing any questions because we covered it all. So, all right. So, Mike, Tracy, thank you so much for lending your expertise today. We very much appreciate it. And to all of you who attended, thanks so much. And we will see you next time.
Thank
Bye-bye.
you.
Thank you.